So my approach to discussing the aging face is as follows. Number one, I actually take a mirror for my patient, and we discuss, looking in that mirror together, issues that they have with their face, things that they'd like to change, things that they'd like to see differently. And I also ask them, if they're going to do a consult, to bring in a photo of themselves 10, 15, 20 years ago. So I can get a good idea of how their face has aged over time, and then address the issues of the change. And then the idea is that what I look at and see when I look at a patient can oftentimes be completely different than what the patient is focusing on. So it's important that you listen, hear what the patient has to say, and understand what their concerns are. And then I think it's a global change to the face. I think it's really not just, oh, stick some fillers in somewhere or do a laser. It's really taking the time, making a plan. And so we'll sit down, we'll talk about the things that bother my patient, and then I'll talk about all the different options I have to address those issues. And so I may say 10 different things, and then they'll say, okay, what would you start with? And we'll just kind of go through the list, because I don't think it's a one and done, and I don't think it's a one treatment fits all. I think you really need to look at the different options you have and how they'll work for that patient. Is it someone that, like I have patients that fly in to see me from Singapore or Australia. So that person is going to get a different plan than a person that I know I'm going to see every 2 months or every month or something like that. So it's really tailoring it for the patient, making sure that you're addressing the issues that that patient has and that they're concerned about, and being realistic, being honest, not telling them that you're going to make them look different, because I don't think we really want to look different. And if someone's really wanting to look different, then they're probably not the patient that you want to treat. You really want someone that you can enhance all of their features and make their face look the best it can possibly be, or the youngest it can possibly be. I think that's how I look at it.